Hello, everybody. I hope everybody's on. This is State Senator Catherine Ingram. Unfortunately, I'm not able to be visible. It's not just a bad hair day, though. It's it's a bad position where I am. But anyway, thank you so much for being here. And of course, the Black Maternal Health Caucus is just one piece of the work that needs to be done in our state for health. Period. It's not just about Black people, but the healthier Black people are. The weakest chain, the weakest link in the chain, as people sometimes refer to people who are um, Black and sometimes marginalized. If we can correct the weakest chain, then of course we can make sure that the chain, correct the weakest link, we can make sure that the chain is very strong. And that's what we need to do. So we're here on behalf of Senator Hicks Hudson and myself. Thank you for being here. And of course, our senior legislative aides are going to conduct the meeting and we'll be here. And if there's any additional questions back to us, because if you're paying attention to what's happening at the State House and in our White House, things are very volatile. So we'll be here for any questions. But in the meantime, I'll turn it over to Deja and Amber, and you can introduce our guest for today.
Thank you so much, Senator, for that introduction. And as the Senator said, thank you all for being here today. It is our first Black Maternal Health Caucus meeting of the year and of the new 136th General Assembly. So we're certainly excited to get the ball rolling and just get back to work or continue the work that you all have been doing and continue advocating for minority health and to improve health outcomes in here in Ohio. And so today we are joined by a very special guest out of Cleveland, Director Angela Newman White. She is the director of First Year Cleveland. Wonderful person, does a lot of great work up there. Had the privilege to meet her on a couple occasions, so I'm very grateful that she was able to be here today to share with you all about the work that they're doing in Cleveland. And just as a note before we get started, the folks that are in the audience, you're not going to be able to necessarily speak throughout the meeting, but I highly encourage you to utilize the Q&A section of the Zoom call, which that's located either at the top, I believe, let's see, at the top, if you're on a phone, there's a little Q&A button. You can type in any questions, comments, or concerns. And I believe on a laptop, it's at the bottom. And then at the end of the meeting, there'll be some time to go through those questions or comments and concerns, whether it's to the director or to the senators. And so Director Newman, if you want to go ahead and get started, I'll stop sharing my screen and then let you go ahead and share yours.
Okay, thanks so much, Deja, for the introduction. And Senators Ingram and Hicks Hudson, I appreciate the opportunity to share the great work of First Year Cleveland. I'm going to share, this is someone else. Okay, hold on, try to share my screen. Okay, and then we'll make it a slideshow. Nope, I think you can see like, well, I don't know if you can see just the main slide or the extra slides.
We can see the main slide.
Okay, good. Okay, so thank you. I'll just go ahead and get started as she mentioned, my name is Angela Newman White. I have the honor and privilege to serve as Executive Director of First Year Cleveland. I've been in this role since January of 2023, and we are housed at Case Western Reserve's School of Applied Social Sciences. And we have a very small but robust team of 5 individuals in our office, but all of the great work that we're able to accomplish is in partnership, not only with our local partners, but those across the state. The mission of First Year Cleveland is to reduce infant mortality, particularly among communities of greatest need, that is in Cuyahoga County, within Black communities. And of course, our vision is to make sure that every baby is celebrating their first birthday, and we have all healthy moms in our county. First Year Cleveland, we're a backbone organization, so we utilize the collective impact framework to support community on what does the community need and how can we provide some strategies to meet the needs of each individual community. So we are a connector, protector, and activator. The connectors piece speaks mostly to our position to build capacity for community organizations. We don't provide direct service out of our office, but we do have the unique position to actively listen to all of the great work, the great organizations, listen to the folks meeting with families, and to identify opportunities to fill gaps with funding, training, and do capacity building projects. Under that protector lens, being at a research institution, we do have the opportunity to engage in research. I know historically, Black families and Black communities have been somewhat exploited in the research kind of lane. And so it's important, and it's a priority of First Year Cleveland, that we only engage with research that provides a direct benefit. So whether that's through applied research or systems level research. Black families and Black communities are a part of all levels of research that comes out of First Year Cleveland. And finally, on the activator side, policy, which is my fun spot, probably the most impactful work that we are doing. We acknowledge the role of racism on infant and maternal health, and we work in partnership with community to develop a robust policy agenda and to pursue policy and systems changes that are rooted in social and racial justice. So as a snapshot, just to compare what birth outcomes look like in Cuyahoga County, over the past 10 years or so, we have the unfortunate position to have consistently higher overall infant mortality for our community. The data from 2022 and 23, let me note here, is preliminary. That significant spike in 2023 has been pretty alarming, for our community, and we're actively working with partners to identify what opportunities we can have to, bring the rate back down. I just want to point out, because I had the opportunity to speak with the Minority Caucus yesterday, that, across the state of Ohio, 912 babies died in 2021. 97 of those babies, unfortunately, were in Cuyahoga County. So about, 10% of the deaths in the state happened right in Cuyahoga County, with the leading causes being consistent across the board, prematurity, birth defects, and sleep-related deaths. The preterm birth rate for our community, is the main driver of infant death. And so, we consistently trend higher than the state and the nation. And so it's our responsibility to focus more intentionally around the prevention of premature births. And though it's not always preventable, there's some clinical interventions that can be implemented to, help mom carry her child to term. But the reality is that the health and well-being of mom prior to and during her pregnancy has the greatest impact. And those are the opportunities that we have as an organization to work collectively on how do we improve the overall health and well-being of women over the life course. Because the bigger picture, using the socio-ecologic model, you have to recognize that healthcare is only 20% of health outcomes. And so, we encourage, of course, healthy behaviors for folks, but also have to consider, what does the environment look like, and is the safe, healthier choice the easier choice? First Year Cleveland is very intentional around shifting the narrative from individual responsibility to systems accountability. And so it's our duty to make sure that all the recommendations that we provide as experts in the field, that we help families navigate that system. Our Richard Stacklin, who is our director of community impact, had developed this social determinants of health index that kind of aligns with, what the data is telling us, that, the communities, that's a map of Cuyahoga County, and it's highlighting, the darker shades of red, those communities that have the greatest burden as it relates to social determinants of health. So, things like poverty, housing, transportation. These communities also are consistent with those that have the higher infant mortality rates, and consequently also have the highest percentages of Black residents, consistent with our redlining maps. And so that historical disinvestment, is the leading contributing factor to why we see inequities across all health indicators today. And so First Year Cleveland has a comprehensive approach to this work. We highly value direct service. We know that we must meet people where they are and provide very valuable education and connection to resources and information. But we acknowledge that folks need resources and direct service because on the upstream side, we haven't done a great job as a nation on ensuring that there's quality conditions. So instead of pulling babies out of the water, we want to make sure that babies don't drop in the water at all. And so we have a kind of an upstream downstream approach using the collective impact framework with all the work that we do. So I'll provide an example because we do so many things, which we're so excited about. I'll just focus on housing. So, as a connector, protector, and activator, First Year Cleveland, it was very fortunate to, be the recipient of some dollars to invest in some different housing initiatives. But we decided to focus on housing because this is what the community was talking mostly about. Like the greatest need was this housing crisis on not only identifying and securing housing, but maintaining it and also making sure that it's safe. And so this information was not only collected through like community listening sessions, but surveys. And we also have a community advisory board. So we know that our families are in need of housing, and it's our responsibility to use the, I want to call it a privilege, to be in the position that we are to find and implement key solutions in partnership with communities. And so what we did was we're grateful for the support of Co-Ohio and the Ohio Department of Children and Youth to recently implement the Healthy Beginnings at Home project. For those of you that aren't aware, this is an evidence-based or informed model that was originally piloted in Columbus that essentially provides a framework of removing housing barriers to securing housing. So we're providing the financial support for that, but then also coupling that with some supportive services to help navigate other needs that families may have. And what I love most about this project is on the applied research side, families are getting an immediate benefit of having the housing, but it also has implications for policy reform on prioritizing pregnancy for subsidy for housing. And so that's like one of the pieces that we're doing. The second one was around community investment dollars. So First Year Cleveland is very grateful for the generous support of our local philanthropy and city and county government. And we were able to allocate funds to fund housing projects. So we have funded an organization to provide rental subsidies for their clients, but we also were able to provide funding to housing providers. So opportunities to enhance the spaces that they're making available to pregnant and parenting families, because we know that there's so many new and unique ways to look at housing that we want to make sure that we're actively investing in and making families aware of those sources. And then finally, we're in the process, pray for us, within the next month or so, launching our Resource Finder app. And that's going to be a way to kind of put the resources in the hands of the consumer. And so having all the lists of housing services and then all of the other myriad of supports that our county has to offer would be, at a click of a button on the downloading on the app. On the activator side for the policy piece, housing is and has been a priority for First Year Cleveland, and also with our partners, our sister seed partners, Cradle Cincinnati and Celebrate One. So we have been, actively providing testimony and also including that in our annual Infant Vitality Advocacy Day. But we also had in Cleveland had the opportunity to attend the Senate Housing Select Committee hosted a listening session here, and we were also able to provide advocacy around income discrimination legislation, making sure that families who have vouchers are not discriminated against, but also some protections around like how do we mitigate this inflation, because there's not, it's just housing is so expensive. And then also really looking at the opportunity to prioritize pregnancy for subsidy. The state of Ohio, without a housing state department, implements the HUD guidelines, prioritizing veterans, persons with disabilities, and older adults. But there could be an opportunity to to look at pregnancy as a priority population. And through the work of the Healthy Beginnings at Home project, we are so excited that our local housing authority has partnered with us to prioritize the persons that participate in the program to receive a subsidy. So this is the first time ever that this has been done, and we're hoping that, you know, as we move through this project, this will prove to be the success of this will kind of hopefully infiltrate, and maybe this could be a standard not only in the county but hopefully across the state of Ohio. I wanted to mention too our mental health. So we have been working diligently to try to address the mental health crisis from multiple levels in our community. The first being supporting the workforce. We're grateful with the partnership with our trauma center here at Case Western Reserve, the ability to provide free training to and support through the perinatal workforce. That's through co-healing training. We understand and acknowledge the trauma, the secondary trauma associated with, you know, engaging with families and re-experiencing and trying to understand and be supportive while taking all that on. And so any opportunity that we can have to support our workforce, we're grateful to have the opportunity to do that. On a systems level, we also acknowledge that there is a huge capacity need around the provision of mental health services. Hospital systems and in larger corporations that have mental health providers, there tends to be a long waiting list here in our community. And those independent consultants or independent mental health providers tend to not engage in the payer system. And so it places the burden on the client to pay all the money. And so we are grateful that we have just launched an RFP to secure a consultant on optimizing Medicaid billing. So we're hoping that our smaller organizations are able to find ways to leverage the managed care plans to make sure that they can provide services to their patients with the insurance covering it and not putting the burden on the client. And then also we're creating a network of non-clinical support. You know, a licensed professional counselor is not the answer for everybody, and we fully acknowledge that. So uplifting all of the phenomenal work within the community of women just supporting women, I think that that's a huge untapped resource. And so we're trying to find ways to make sure that more consumers and families are aware and utilize these supports to address stress. I want to just point out for all those of you on the call, you know, the governor's budget is dropping on Monday, and there's a lot of opportunities for us to consistently engage with our legislators on the budget moving forward. And so, you know, we all know that House Bill 7 passed with the removal of the $34 million in appropriations. So it's more focused on policy, which I know that's because of the timing. And so, you know, there are opportunities for us to talk about, you know, some of those highly impactful strategies that were noted in House Bill 7 that we want to make sure that when we're looking at how the governor's budget is spanning out, where it's going to settle, that we uplift. These are just examples of some of the key priorities in that bill, that we uplift the value of these interventions and our supportive services, and that they are considered in this next biennium budget. And I also would be remiss to, you know, not to highlight our partnership again with Cradle Cincinnati Celebrate One groundwork and OCPIM on our shared statewide priorities. The Sister Cs, we engage consistently because we do represent the largest urban communities with the highest incidence of Black infant mortality. And so we meet to talk about, you know, what are some key areas that can not only affect or impact us, but has statewide implications. And so, you know, we've been working on housing, mental health, diapers more is related to basic needs. How do we offset the economic challenges that families have and to reduce stressors? And of course, you know, House Bill 7, we were working on that for 2 years. And so I'll end with, you know, folks say, well, what can I do? And I know a lot of individuals on this call kind of know, but we always reiterate the importance of listening to community. The answers are in the community. You know, utilizing some quantitative data and things like that has some value, but the actual creation and what something looks like when you are, you know, implementing it is so much more impactful when the community is involved from the start. We encourage everyone to meet with their local and statewide legislators, sharing their stories and you know, to really provide further justification on why the joint focus with community listening is so important and impactful when we're thinking about these policies that are coming down the pike. What are our opportunities here? And in September, we are hosting, we haven't picked the date yet, but be on the lookout, our third Infant Vitality Advocacy Day. And we invite all of you to join us to meet with the legislators and keep this advocacy work going. So with that, I know I talked really fast, but that's kind of an overview and a snippet of First Year Cleveland. And I'll take questions if you have them.
Thank you so much, Director. This is Deja. Just to let everyone know, again, if you have any questions or any comments that you would like to share, please feel free to put those in the Q&A so that we can ask those directly to the Director. You just type it in and then I can read it off. And while folks are maybe trying to figure that out or working on their questions, I actually did have a question for you, Director. When you were talking about the expansion with HUD and like expanding the priority populations in terms of like the housing vouchers and how at the local level in Cleveland that they have moved to prioritize pregnant folks as well. Can you explain a little more of like what that would look like? Are you saying at the state level, or is that a federal way of getting that to be expanded, or what would that look like?
So how it works in our community, so we have a waiting list, and I felt like it was around 20,000 people for housing vouchers in Cleveland or in Cuyahoga County. And unless you are a part of those three, veterans, persons over 65, or with a disability, it's a lottery on how they select who receives a voucher. And so unfortunately, like there's just no guarantee that you will ever receive the voucher. And so what we have, the agreement that we have, and it's only for the clients that participate in healthy beginnings at home. So let's be clear, it's not for all Cuyahoga County pregnant people, but they have agreed to move those folks to the list, to the top of the list. And actually, they're just giving them vouchers once the program in our support ends. They'll be eligible for the vouchers and indefinitely, as long as they meet all the eligibility for CMHA. And it also, what's also helpful with this piece is that our local housing partner Eden is going to be able to seamlessly the person won't have to move essentially. So they would just transition from the subsidies that we're providing through the funding to the CMHA. So statewide, there could be an opportunity that, I guess, if someone presents pregnant and they approach a housing provider, could they move to the top of the list? Like that's the goal, right? Can we say, here's a voucher for you. Let's find you some housing, because housing is closely tied to adverse health outcomes overall, but especially, there's a lot of housing instability. In Cleveland, the only priority kind of housing project is through our rapid housing program. And the family would have to check into a homeless shelter to be eligible for that program. And to have to put that extra level of trauma on someone, I don't think is appropriate. And so, how do we just avoid all of that? And the goal is, can pregnant women be of a priority if there is a wait list? That was a long answer, but
No, thank you. That was very thoughtful, and it definitely helped put more context to like what that situation is and how to translate what you're doing in Cleveland, maybe what that would look like at the state level. And then we do have a question in the Q&A from Senator Paula Hicks Hudson's office. And the question is, does First Year Cleveland have any specific data about the environmental effects on pregnancy and infants, like PFAs, maybe like air quality, things like that, like as it relates to like that map and what that looks like?
so we don't have any like on hand. In full transparency, I can't quote any data, but we do participate on Mayor Bibb's prenatal to 3 advisory group, where environmental risk factors is one of the kind of priorities. And so looking at air pollution, looking at lead poisoning, those communities are consistent with the red line map. I mean, there are different issues related to air quality. We've talked a lot about like tree coverage, like how do we get more trees planted that not only absorbs a lot of the toxins in the air, but also provides some relief from the heat in the hot summers. But lead is one of the biggest environmental risk factors that we see as relates to child development, not specifically infant mortality, but trying to leverage not only the funding available for the abatement, but what's the bigger ask for us. But I can look into that and get back to you on some data specific to environmental. Thank you for the
Yes.
question, Senator.
Yeah, certainly. That was from Senator Hicks Hudson. And then I guess I just had another question as we were listening. You spoke about the shift between individual responsibility and focusing more on the system accountability. And I feel like a lot of people I'm sure on the call maybe have heard maybe that briefly or have talked about how taking the blame off the individual and for their outcomes and looking at it in a larger picture. And that's where like the legislation comes in and things like that. So I don't know if you want to expand on just that generally or just kind of just like go into that a little bit more of what that looks like um, to like shift that narrative to really address the systemic issues that are causing these outcomes.
I mean, I think it's about, so there's a lack of, I don't want to call it appreciation, but maybe it's a lack of appreciation of what it's really like to navigate a system. And, the recommendation that we always have is that you go through it yourself so you really understand how easy it is. Our county executive, Ronayne, had all of his administrative staff commit to riding public transit for a week, so they could see what is it like to have to use public transportation. Is it really that simple for that to happen? And then the realization is like, well, we need to, improve the frequency and the connecting stops to make it more efficient for the rider. And I think, excuse me, so we don't, I mean, it's the way I can, I guess, describe it is like you just have to think about how easy is it. If we're asking of families to eat healthier, you have to understand where they live, if they have access to, and if they can afford the food that you're suggesting that they consume. And I don't want any family to feel guilty about experiencing an adverse birth outcome when it was outside of their control. I think we do a lot of telling people what they need to do, but don't necessarily make sure that they're able to do it. And that's kind of how we are navigating this. When I gave the example about the mental health services, like if we recognize mental health as the number one contributing factor for maternal mortality and talking about the importance of addressing mental health, we could tell someone to go to see someone, but how easy, the reality is that there aren't any available appointments. And so what we're doing at First Year Cleveland is trying to expand that. So we recognize that the infrastructure cannot support the need currently. And so I think it's our responsibility to address that. So now if we ask someone to pursue these services, that they can easily access it. We've done the same thing with, in partnership with the Cuyahoga County Board of Health and our Greater Cleveland Transit Authority around transportation. We asked people about, barriers to getting to places. It says public transit, but RTA historically only surveys their riders. So the people that ride the bus, they cater to what they need. But if the goal of public transit is to eliminate barriers to transportation for people that don't have access, how are we asking and engaging the community on, just giving someone a bus pass is not the solution. Because if I have to wait 45 minutes at a pole with a baby, I'm not going to ride the bus. And so by improving infrastructure, we were able to secure funds through the Ohio Department of Transportation to install bus shelters and seating and lighting, making it safer. Now the system has accommodated the family that you've given a bus pass to, and now they can more easily access the public transportation. So like those are examples of you have to do, it's like a both and. You cannot just give directives to folks without really looking at the context in which they're expected to implement that strategy or behavior.
Thank you so much for that explanation. I think that that really sheds light on what that looks like on the ground. And as a generic example, I feel folks maybe have heard kind of, for example, like, if you're helping someone who's unhoused, giving them a canned good that doesn't have a can opener or like the tab to open it. It's kind of like, well, where are they going to cook it at? Like you gave them the
Yeah.
can, but what now? They can't do anything with it. It's not useful. So I think that that's really important to understand the context that, people might have good intentions, but you have to look at the bigger picture and understand how does that actually work for that person? Or are you thinking it's just on your understanding what would be helpful versus what would actually help them? And then we have another question from Representative Erica White. She says, are there community baby showers still? And is that a way, like still as a way to help provide resources and identify ways to help our community?
Absolutely.
Yes.
Absolutely. There are baby showers and tons of community events. First Year Cleveland, we support all of our partner organizations if they request, some fiscal support, but we are very, very intentional around providing opportunities to not only give people things that they need, but also resources and connecting to services. There's also educational opportunities and workshops. I know our partners like Pregnant with Possibility and Birthing Beautiful Communities, Neighborhood Leadership Institute, Moms First, Moms and Babies First, they all are doing a series of events. And I'm missing some other folks, so if they're on the call, I'm sorry, but we do baby showers. I think that in an immediate need piece, it does address something that could, if I'm in need of diapers or a car seat or something like that, it's great. It does provide an opportunity to learn something or meet somebody, build relationships, but it is not the answer. And it's hard to evaluate if you're looking at like, well, what is the impact? So I think that we should continue to do it, but the ongoing consistent support is of most value.
Let me jump in for a second because this is Senator Ingram again. I just really want to ask, because you mentioned House Bill 7, and that was a White and Humphreys bill, and it did go through. Unfortunately, it took out the appropriation. Now, of course, and that was deliberate because knowing that here we come with the budget.
Mhm.
But besides that, and I like the idea of the connector piece because this is what we forget. There's so many things that touch on everything:
Mhm.
education, housing, uh, a living wage, transportation, all those other things. So the transportation budget is coming up too. So my whole thing is in all of those that what other language could we use to make sure that the dollars get to where they are needed? Because I tell people all the time, and they talk about mental health. And just yesterday we talked about um, some other thing that's in the budget. And the dollars are huge. But do they get to where they need to be? So I'd like for you to help us with in all of those budgets when the Department of Development, when those folks come in, or when education comes in, then how are we making sure that whatever they're laying out there gets to where it needs to be? So your list of priorities are good, but how do we target getting some of those monies that are already there?
Absolutely. I was doing some research in preparation for the Minority Caucus yesterday, and when I saw that the last biennium budget for ODOT was $13.6 billion and only 123 million was allocated to public transit. So that was like less than 1% of the budget. And 123 million divided by 88 counties is nothing, it's no money. And so there are definitely opportunities, and I would love to follow up with you. But at the base of it, it's really looking at the data and equity. Like we have to invest and ask people what they really need, because the answers for Cuyahoga County are not the same for a rural community or an Appalachia. There's different needs for different communities. And I think that's what gets so that's what's so disappointing, is that there's this blanket investment with not taking into consideration the nuanced needs per community.
Thank you. Yeah, we need to follow the money.
Yes.
Thank you for that. And then we just got another message here from Tony Oberly down in Cincinnati, Cradle Cincinnati, Queens Village. They had just made a comment that, to Senator Ingram, to your point, that, health in all policies, that framework could be useful as we're moving forward and moving through the budget and and making sure we're considering health and how you said it's education, it's housing, and understanding how that can relate to all of our health outcomes, even though it might be a different topic per se than health. So she just wanted to make that point there. Thank you so much for everyone that's, submitting questions and engaging in this conversation. I had one last question on my end.
Deja, you're going to go, when you finish with this question, you're going to turn it over to Senator Hicks Hudson.
Okay, yeah, perfect. It was about the housing or the housing committee that you attended in Cleveland when I know the members had gone there, and you had mentioned a few pieces of legislation such as like income discrimination and like mitigating inflation with housing. I was just wondering if you had any follow-up on where those pieces are, or like maybe like what you've heard back from that experience and your suggestions.
I have not heard back on the experience. I do know that the House bill, I believe, because it was Representative Upchurch that introduced, I think it's House Bill 115. It did not pass in the last General Assembly. We work with Capital Partners, our lobbyists. I want to reach back out to see if there'd be an opportunity to reintroduce that legislation. I know they're looking at least here locally, like trying to have some parameters around out of state and out of country purchasers for homes that are really driving the prices up for these homes, and the rental costs. But I haven't heard very much since that meeting. I think there's been a lot of priorities, I guess, in the city of Cleveland. They have been working to pass legislation as it relates to taxes. And so especially protecting older adults, those folks that are retired and paid off their houses, and now their house is worth 3 times as much, and they're being taxed on the new appropriated value, which is kind of like really unfair. I mean, and so there's protections being put in place for older adults to at least keep their homes. They're focusing a lot on homeowners and not so much on renters. And so I would love to see more supports for renters, because I couldn't imagine even being a first-time home buyer right now. Like, who can afford it? No one. So
Right. Thank you so much. Before I pass it over to Senator Hicks Hudson, Rep. Veronica Sims, I see that you have your hand raised in the attendees list here. If you have a question and you're able to, you can put it in the question and answer box so that we can get to you. I don't want to not get to your question, but that will be the way that we're able to see what maybe your question or comment is if you type it in to the Q&A. And then in the meantime, while we're waiting for her to get her comment in the Q&A, I will pass it over to Senator Hicks Hudson, as Senator Ingram had mentioned.
Yes, I want to let you guys know the senator is currently switching her link. She had joined as a participant and not a panelist. But Dr. Newman White, I also wanted to thank you for all of the information that you shared. I think that you did a really phenomenal job to reiterate what Deja and Senator Ingram said of highlighting the systems that create the inequity in the unfortunate maternal mortality and or maternal morbidity and infant mortality rates. So the senator is rejoining. She'll be on shortly.
In the meantime, do you have that question yet?
I do not have the question yet. I seen she put her hand down, so she might be typing it in at the moment. So I'm just waiting to see if it'll appear in the Q&A box.
Yeah, and while we're waiting for a lot of this, the reality is that that's the only reason we're here, Because as legislators, when we get the budget, we know that, okay, we need money for affordable housing, and we know that pregnant mothers need some attention, and of course, birthing centers and doulas and all those other things. But the reality is that the state spends a lot of money, and there is a lot of money that goes to certain organizations. And we go, well, wait a minute, can't the birthing folks, can't the Cleveland First, or can't those folks get some dollars out of some of those other areas that are already, they've got the whole lump sum of money? Can we target it to where it goes? And therefore, in my mind, is the issue with where we send it. When we started talking about healthy mothers, they were sending the money to some group. I mean, this is a couple of GAs ago, but the question became, well, then what do they do with it? It doesn't get down to us. And it doesn't get down to who actually needs it. And here again, transportation. Okay, it may seem like, as was alluded to, that's not a lot of money that goes to public transportation, and rural areas need it just as much as, if not more than, some of our urban core or suburban areas. And so how do we work with those folks who are getting that public transportation money to say, have you asked the people what they really need, or do you just have a bus line? So those are things that we as legislators, and I know there's a few of you on the call, need to be looking at when that budget comes to us that the governor's put in. And he usually puts in a lot of money. Mental health, look at all the money we spent. Well, but where does it really go? So hopefully I've taken up enough time for the question to be there, or for Senator Hicks Hudson to be ready.
So I don't know if Senator Hicks Hudson is on yet. I don't see her necessarily in the panelist section. However, we did just get another question, well, more so comment in the Q&A. It's from Amari Davis. She is down in Cincinnati on behalf of Councilwoman Mika Owens. And she just throws out there, like, what can we do down in the city of Cincinnati to keep building this up and keep the force going? And Senator, I don't know if you want to speak to that, but that's on behalf of Councilwoman Mika Owens of Cincinnati.
But herein lies the question we have, and we used to do for years, is that we need to make sure that our electeds are all talking to one another about what they're doing. The city has to remember that their dollars usually come from the taxpayers, of course, and comes from the feds maybe, but they usually come through the state. And a lot of those other programming that we do are either state subsidized, et cetera. So having conversations about what's going on. When we talk about infant mortality and we've got Cradle Cincinnati, let's have that conversation about where we really are. And then if the city needs to have some changes made, or they're putting some dollars through, for instance, we had to do a change at the state level in order to be able to change some zoning. And the city was changing the zoning, but they had to go through the state to get that done. So those are all things that we need to talk about. And then, of course, making sure that while we are at the state level talking about, say, tiny houses, that they are allowed to be those modular housing in those municipalities. So it's a way of having that conversation. So talking back and forth, and then, of course, letting us know at the policy level what needs to be there, because I'm certain that Councilwoman Owens' office knows that there are lots of people in Cincinnati asking for lots of line items for themselves for all kinds of things.
And I just want to jump in here quickly. The senator, we're having a bit of technical issues. She won't be able to hop back on, but she did just want to reiterate again, a thanks to you, Dr. Newman White, for the very thorough overview that you gave. And she also wanted to remind everyone, like Senator Ingram said, to continue to follow the money and actively look at what the budget process is going through as it moves through the House and then to the Senate, so that where pockets of money crop up that can be utilized, or programs that can be accessed, they can be going back to our communities.
Sounds good. Do you guys want to take it away?
Yeah, I was gonna say, Senator, I think that looking at the Q&A, we've gotten a chance to get to everyone who did submit a question. Obviously, if you have any additional questions or comments or anything that you would like to share, please don't hesitate to follow up with either the Ingram office or Senator Hicks Hudson's office. Feel free to email us and we can definitely get you connected or answer any questions you have to Executive Director Angela Newman White. And just thank you again for everyone being here. I think we're all very excited to continue the work in the 136th General Assembly and definitely the focus on the budget as we keep moving forward. So yeah, thanks again, everyone, for participating today, and look out for February's Black Maternal Health virtual webinar meeting as well. We'll keep you updated on when that will take place and who we'll have. So thank you again so much, Director, for being here. So.
Thanks, Director. Thank you, folks. Bye.
Thank you. Bye.